You know how sometimes you're just going about your day, maybe brushing your teeth, and you notice a spot of color in your mouth that wasn't there before, or maybe has been there, but you're suddenly more aware of it? It can definitely make you pause and think.
Oh, absolutely.
Well, that's what we're diving into today. Those pigmented lesions you might see in your mouth.
That's right. You've given us some excellent resources, and our goal in this deep dive is to really unpack these oral discolorations for you. We want to help you understand what could be a completely normal quirk, of your individual biology and what might suggest it's worth getting a professional opinion.
Right.
Think of this as your shortcut to being well-informed without getting bogged down in overly medical language.
Okay, let's get right to it then. The sources we looked at essentially categorize these pigmented spots into two main groups. First, we have lesions, where the color comes from melanin, the same pigment responsible for the color of your skin and hair.
Hmm?
And the second group involves discolorations caused by other things, like certain medications, metals that can become embedded in your oral tissues, or even exposure to heavy metals.
Exactly. Let's start by focusing on those melanin-related lesions, as they tend to be encountered more frequently. The first type the sources discuss is what's known as physiological pigmentation.
Physiological pigmentation. Okay, that sounds like it's generally nothing to be concerned about. What's the key thing to understand about it?
Well, the crucial insight here is that this is often just a normal variation in oral coloring, sort of like a skin birthmark. It typically appears as a symmetrical pigmentation, meaning it looks similar on both sides of your mouth
Okay.
and tends to be persistent. Importantly, it doesn't alter the normal texture of your oral tissues. For example, you should still see the usual stippling on your gums if it's typically there.
So it's like a baseline level of coloration that's just part of your unique makeup and doesn't change the surface of things.
Precisely. And here's something that might surprise you. The degree of this pigmentation in your mouth doesn't always directly correlate with your overall skin tone.
Oh, really?
Yeah. Someone with very dark skin might have minimal pigmentation on their gums, and conversely, a person with a lighter complexion could have quite noticeable dark pigmentation in their mouth. It's not a one-to-one relationship.
Huh.
While this physiological pigmentation can technically occur anywhere in your mouth, the gums are the most common location.
Interesting. So what's happening at a cellular level to cause this kind of pigmentation?
That's a key question. It's important to know that this type of pigmentation isn't due to having a greater number of pigment-producing cells, called melanocytes.
Oh, wow.
Instead,
Oh.
the normal number of melanocytes present are simply producing more melanin in those areas.
Ah, so it's not more workers, just the same team putting in more effort, kind of.
Exactly. That's a good way to put it. Now, while physiological pigmentation is generally harmless, it's important to be aware of what it shouldn't look like.
Right.
Any sudden changes in color or size, irregular borders, or if the area becomes painful or ulcerated, those are atypical features that would warrant a closer look from a healthcare professional.
Makes sense if something seems out of the ordinary for you. It's always worth checking in. Okay, so that's the baseline, normal variation. What's the next melanin-related lesion on our list?
The next category is smoking-associated melanosis. As the name suggests, this is directly linked to the use of tobacco, particularly cigarette smoking,
Okay.
although it can also be observed in pipe smokers.
So it's like the mouth reacting to the smoke and producing more pigment as a response?
In a way, yes. This pathogenesis, or how it develops, is thought to involve certain components in tobacco smoke that stimulate the existing melanocytes in your mouth to produce more melanin. Again, it's not an increase in the number of cells, just an increase in their activity.
And where in the mouth is this smoking-related pigmentation most likely to appear?
The front part of the lower gums, specifically the labial gingiva, that's the part facing the lips, is the most typical location.
Okay, front lower gums.
Yeah. It often presents as a brownish discoloration, and the intensity can vary quite a bit, from very subtle to quite noticeable, depending on the individual smoking habits. Interestingly, the palate and the inside of the cheeks have also been associated with pigmentation in pipe smokers.
So the location can be a helpful clue. Now, is this pigmentation itself harmful, or is it more of an indicator that someone is smoking?
It's primarily an indicator of smoking. The good news is that this pigmentation can actually fade or even disappear if someone quits smoking.
Oh, that's good.
Yeah, it can take several months to years, though, depending on the duration and intensity of their smoking habit. However, and this is important, the sources emphasize that if you observe surface irregularities or very dark, intensely pigmented spots in someone who smokes, Those features do require further investigation.
Like a biopsy.
Yes, possibly including a biopsy to rule out other potential issues.
Okay, so quitting smoking has even more potential benefits than we thought. What's the next type of melanin-related lesion we should be aware of?
Next up are oral melanotic maculans. Think of these as small, flat, asymptomatic spots in your mouth, much like freckles on your skin.
Oh, okay. Freckles in the mouth, that gives a good visual. So are these something that typically require any treatment or cause for concern on their own?
Well, the sources reassure us that solitary oral melanotic macules have no inherent malignant potential. They are generally benign.
Phew.
However, here's a really important point. When you start seeing these macules appearing in large numbers, scattered throughout the mouth and even around the lips, was described as an oral imperial distribution.
Wait, multiple spots?
Yes, multiple spots. That can be an early indicator of underlying systemic conditions.
Wait a minute, so these seemingly harmless little spots could actually be a red flag for something going on elsewhere in the body. That's unexpected.
Exactly. The sources specifically highlight Peutz-Jeghers syndrome and Addison's disease as conditions to consider when there's an abundance of these oral melanotic macules.
Wow.
This is a prime example of how a seemingly minor oral finding can connect to a much broader health picture.
Okay, let's delve into these two conditions a bit. First, Peutz-Jeghers syndrome. What's the link there?
Peutz-Jeghers syndrome is a genetic disorder, often due to a mutation in a specific gene. It's inherited, and the key connection here is the presence of these freckle-like melanotic macules, along with the development of polyps in the intestines.
Intestinal polyps, that doesn't sound ideal.
Well, these polyps, which are predominantly found in the small intestine, are a type of growth called hamartomas, essentially, disorganized growths of normal tissue. While generally benign themselves, they can lead to issues like abdominal pain and bleeding.
Okay.
Critically, individuals with Peutz-Jeghers syndrome have a significantly increased risk of developing various cancers, including those of the gastrointestinal tract, breast, and ovaries. So, recognizing the oral signs can be crucial for early diagnosis and management of the syndrome and its associated risks.
That's a significant connection, really significant. Okay, what about Addison's disease? How does that relate to oral pigmentation?
Addison's disease, or primary adrenal insufficiency, occurs when the adrenal glands don't produce enough vital hormones, particularly cortisol.
Right, the stress hormone.
Exactly. The link to pigmentation arises from the body's compensatory mechanisms. When cortisol levels are low, the pituitary gland produces more adrenocorticotropic hormone, or ACTH. Now, ACTH is related to another hormone called melanocyte-stimulating hormone, or MSH. Increased levels of both ACTH and MSH can stimulate the melanocytes, leading to increased melanin production.
So it's a hormonal domino effect that results in more pigment being produced.
Precisely. In Addison's disease, this often leads to a widespread darkening of the skin, sometimes described as a bronzing.
Bronzing, okay.
Alongside this, you can see oral freckles and larger melanotic macules. It's important to remember that it's not just about the mouth. Other symptoms like fatigue, weight loss, and low blood pressure are key indicators of Addison's disease.
Ah, so the bigger picture.
Yeah, the oral spots are often just one piece of a larger clinical puzzle.
So if someone has numerous oral freckles along with that bronzing of the skin and feels unusually tired, Addison's could be a consideration.
Exactly. The sources also briefly mention other, less common conditions that can be in the differential diagnosis for multiple oral melanotic macules, like Carney's complex Adlagi-Hunziker syndrome. While we won't go into each one today, it just underscores the importance of a thorough medical evaluation if you notice a sudden increase in these spots.
Definitely.
For typical solitary oral melanotic macules, while a biopsy might be done for confirmation, treatment of the macule itself is usually not necessary.
Okay, that's good to know. So multiple mouth freckles can be a signal to look closer. What about something we more commonly associate with skin moles? Can you get moles in your mouth?
Yes, you can, although they are relatively rare in the oral cavity. The medical term for a mole is melanocytic nevus. These are essentially clusters of pigment-producing cells.
Like on your skin?
Exactly like on your skin. They typically appear as small, slightly raised bumps or nodules. Interestingly, the sources mention that in about 20% of cases, these oral nevus can actually be non-pigmented.
No color.
Right, meaning they appear as just a pale bump. The roof of the mouth, or palate, is a common location for them.
Raised bumps, so they have a different texture compared to the flat macules we just talked about.
Correct. The sources also mention different types of melanocytic neva based on the location of these pigment cell clusters within the oral tissue's junctional, intramucosal compound. Intramucosal is the most common in the mouth, followed by blue nevi.
Okay, lots of types.
While these classifications exist, the key takeaway for you is that they are raised lesions. Now, everyone is aware of the potential for skin moles to become cancerous. Is that a concern with oral nevus as well?
This is a really important question, yeah.
It is, and here's where it gets a little nuanced. While the sources indicate that the likelihood of a benign oral melanocytic nevus transforming into a malignancy is quite low, highly improbable even.
Okay, that's reassuring.
But they also strongly recommend that any undiagnosed pigmented lesion in the mouth should be biopsied.
Wait, why? If the risk is low.
The reason for this seemingly contradictory advice is that oral nevi can sometimes clinically resemble melanoma, the malignant form of these pigment cells. They can look very similar.
Ah, I see.
So even if the statistical risk of an oral mole becoming cancerous is small, the need to rule out melanoma from the outset is paramount. You just can't be sure by looking alone.
So the cautious approach is always best. If it's an undiagnosed pigmented bump in your mouth, get it checked by a professional. And what's the standard approach if an oral melanocytic nevus is suspected?
Due to that necessity of excluding melanoma, surgical removal or excision is the recommended treatment for suspected oral neva.
Taking it out completely.
Yes. This allows for a comprehensive microscopic examination of the entire lesion to confirm what it is.
Okay, excision is the standard procedure. That brings us to the most serious type of pigmented lesion, melanoma. What are the critical things we need to understand about malignant pigmented lesions in the mouth?
Oral melanoma is indeed the malignant form, and it's vital to be aware of its characteristics. While skin melanoma is often linked to ultraviolet UV exposure and is more prevalent in certain populations.
Like fair-skinned people.
Right. Oral melanoma, thankfully, is rare and doesn't seem to show the same racial predilection within the mouth.
Rare is good to hear, but it still underscores the importance of vigilance. What are some of the key features that should raise a red flag?
Well, the sources point out a concerning factor. In some instances, a pre-existing area of melanin pigmentation, or even a pre-existing nevus, has been noted in the same location where an oral melanoma later developed.
So a spot that was already there can change.
It can. This highlights the importance of keeping an eye on any pigmented spots in your mouth over time, even ones you've had for a while. While there are different microscopic classifications of oral melanoma, like invasive versus in situ, the most important thing for you to know are the visual cues.
And those visual cues are often summarized by the ABCB rule, right? How does that apply to lesions you might see in your mouth?
Exactly. The ABCD features should definitely prompt concern. A stands for asymmetry. The lesion lacks uniformity in shape. One side doesn't mirror the other.
Okay, A for asymmetry.
B is for irregular border. The edges are notched, blurred, or ragged, not smooth or well-defined.
B for border.
C refers to color variation. Instead of a consistent shade, you might see a mix of brown, black, blue, or even red within the same lesion.
C for color. Got it.
And D is for diameter. Typically, melanomas are larger than 6 millimeters, about the size of a pencil eraser. But really, any pigmented spot that shows a noticeable increase in size over time is a cause for concern, regardless of initial size.
D for diameter or maybe developing.
You could think of it as developing or changing, yes. The sources also mention other warning signs, like changes in the surface of the lesion, such as thickening, becoming raised, bleeding, or ulceration, and just generally poorly defined margins.
Those are definitely features that should not be ignored. So if you observe any of those ABCD characteristics or those other changes in a pigmented spot in your mouth, what's the recommended action?
The message is absolutely clear. Even if a pigmented spot in your mouth seems initially harmless, if it exhibits any of those concerning features, or if you simply have any doubt about it, it absolutely needs to be biopsied.
No waiting.
No waiting. Oral melanoma is a serious condition with a significantly lower survival rate compared to skin melanoma. This is often attributed to delayed detection, as these spots in the mouth might not be noticed or may be dismissed until they reach a more advanced stage.
Right, because they're kind of hidden away sometimes.
Exactly. Delayed detection is indeed a significant challenge with oral melanoma.
Okay, so we've covered the melanin-related pigmented lesions pretty thoroughly. Now let's turn our attention to the second category, the non-melanin pigmented lesions. What are the main types we should be aware of there?
Right. The first and probably the most common type of non-melanin pigmented lesion you might encounter in your mouth is the amalgam tattoo, also known as focal arterosis.
Amalgam tattoo, like from fillings.
You're absolutely right. This is frequently caused by the unintentional introduction of amalgam particles. That's the silver-colored material used in some dental fillings into the soft tissues of your mouth during dental procedures.
How does that happen?
It can occur during the placement or removal of fillings, maybe during an extraction near a filling, or even during the polishing of old amalgam restorations, where tiny particles can become embedded in the gums or cheek. It's actually quite common.
Huh.
And you might even have one without a specific memory of when it occurred.
So it's almost like a little bit of the filling material gets lodged in the gum or cheek tissue?
Precisely. Because it's so prevalent, it's quite likely that you or someone you know might have one. These typically appear near teeth that have amalgam restorations
Makes sense.
and present as flat gray or bluish-gray areas.
Hmm.
A key characteristic is that they generally remain stable in size and color over time. They don't change much.
And how can you be sure it's just an amalgam tattoo and not something more serious like melanoma again?
That's a good question. Often, the presence of a nearby amalgam filling and the stable appearance of the gray spot are strong indicators. Also, if the amalgam particles are large enough, they can sometimes be visible on dental x-rays, which helps confirm it.
Ah, X-rays can see it?
Sometimes, yes. While these are generally completely harmless and require no treatment, it's still important to be able to distinguish them from other dark lesions like melanoma, especially if it's in an unusual location or seems to change. If there's any uncertainty, a biopsy can be performed for definitive diagnosis.
Okay, so amalgam tattoos are the most common non-melanin type, usually benign, and linked to past dental work. What's the next category?
The next category involves drug-induced pigmentations. Certain medications can cause discoloration of the oral tissues as a side effect.
Oh, like a side effect you don't expect.
Exactly. One of the more commonly mentioned culprits in the sources is tetracycline, particularly minocycline, which is often prescribed for things like acne.
I've heard of minocycline.
Yeah. It can sometimes lead to a yellowish or grayish discoloration in the mouth, sometimes even affecting the teeth if taken during development, but also the soft tissues. If you notice a change in your mouth color after starting a new medication, especially one like minocycline, it's definitely worth mentioning to your doctor or dentist.
So it's the medication itself causing a change in the tissue color, not melanin this time.
Exactly. The pigment might be the drug itself or some metabolic byproduct.
Mm.
The sources also list other drugs that have been associated with oral pigmentation, things like imidaclinids used for malaria, cyclophosphamide, chemotherapy, amiodarone, heart rhythm, zidovudine, HIV medication, quinacrine, and clofazimine, used for leprosy.
Wow, quite a list.
It is. The important point here is that a thorough understanding of your medical history, including all medications you are currently taking or have taken in the past, is crucial when evaluating any oral pigmentation.
That makes perfect sense. Your overall health and medications can definitely play a role in what you see in your mouth. And the last type of non-melanin pigmentation mentioned involves heavy metals.
Yes, past exposure to certain heavy metals can also lead to oral pigmentation. This is less common now with better occupational safety, but metals like arsenic, bismuth, lead, and mercury can be deposited in the oral mucosa.
How does that look?
It often appears as a gray to black linear discoloration right along the gum line, at the very edge where the gum meets the teeth. Historically, the lead line was a well-known sign of lead poisoning.
Right, I think I've heard of that.
Similarly, a bismuth line can occur with bismuth exposure. Bismuth used to be in some medications more commonly. And bismuth has also been associated with a temporary black tongue, which looks alarming, but is usually harmless and related to bismuth interacting with sulfur in the mouth.
Black tongue, okay.
Again, like with the drug-induced types, a detailed medical and occupational history is really key in identifying these types of pigmentations. Asking about potential exposures is important.
So with this wide range of pigmented lesions, both those involving melanin and those that don't, what are the absolute key takeaways for you, our listener? What's the bottom line?
The most crucial thing to remember is this. While many pigmented lesions in the mouth are benign and represent normal variations, or are reactions to factors like smoking or dental work, any new, changing, or concerning spots, especially those that exhibit irregular characteristics like asymmetry, uneven borders, varied colors, or a rapid increase in size, absolutely warrant evaluation by a healthcare professional, such as your dentist or physician.
Right, when in doubt, get it checked out. That's the bottom line. Don't ignore it.
Exactly. Don't ignore it. It's always better to err on the side of caution. Early detection is key, especially for something like melanoma.
Definitely.
This deep dive has aimed to provide you with a foundational understanding of the different types of pigmented lesions that can occur in your mouth, their potential causes, and, most importantly, when it becomes essential to seek professional advice. Being well informed empowers you to be more aware of what's happening in your own body.
So, what's a final thought to leave you with today? Something to chew on, so to speak.
Huh, nice one. Okay, how about this? Take a moment, maybe next time you're brushing, to gently examine your own mouth. Have you ever noticed any of these discolorations we talked about? Well, the vast majority are likely nothing to worry about. Just being informed and aware is the first step in taking proactive care of your health. And maybe think, what other seemingly minor bodily changes might hold more significant underlying stories?